Hi, this is Dr. Khan. So I have just completed 100% total capsulectomy. Nice lady, 68 years of age. She has 640 cc implant. She had right breast cancer, and then in 2014 she had the tissue expander and reconstruction. So she comes to me with the many signs and symptoms of breast implant illness, neck and back pain, and all the problems that you can imagine. So the cancer site is on the right side. You can see the cancer flap. She had very large implants, so I'm going to do the second. The left side, this is the mastectomy scar. You can see the scar right in the center. This is where I've oriented it with the stitch so that we know this is the superior. When I flip this around, you can see this is the underside of the mastectomy. Now, as you can see right here, some inflamed tissue. I did not like this tissue that was in the proximity of this, and I did the entire implant capsule and all inflamed tissue removal. If I touch this, this does not feel normal. Again, same thing over here. It's hard, indurated. So what I'm going to do here is I'm going to go ahead and cut this open, and very hard. Look how hard it is. As I go in, you have very large implant. We'll try to squeeze it out of here. Actually, let me go in. So you have very slimy, as you can imagine, slippery. Let's look at this. This is the secondary capsule that we have seen many times. I'm going to remove this because I want to send this off to pathology as well, just to be complete. Now let me show you this. As I go around, look, this is what appears to be an intact implant. If I go around, you see this gum sign. This is your gel bleed that's occurring. This is slowly leaching into the body that's causing all this symptoms. And I'm just going to be complete. There's a very thin layer directly on top, so I'm going to remove as much as I can. Now wherever you see this, this is your Allergan 640, just like the operative note said. I'm going to send this off with the capsule. So overall, as you will see, this layer is certainly very much present. I'm going to leave it on. But I just want to show how thin this is. Some people may think this is the capsule in itself and remove this, but no, you have to remove all of that inflamed tissue so you can see how thin, like a transparent membrane, this is. Now if I go in over here, you have some what is interesting, this is like this. I want to cut this open right here. You can see it looks like a small pea-sized mass, maybe. So this looks like a lymph node. See, it's a pathologic lymph node right in the proximity. So what I'm going to do is, it does not look normal. I don't want to send this with a capsule and the pathologist may miss it. So I'm actually going to cut this and call it a left chest mass. As you saw, this is clearly a nice, well circumscribed mass. And I'm just going to tear this off right here. I'm going to call this as a left chest mass. As you can see, it's a discrete entity. I'm just going to squeeze this off, so I don't want to cut around it. So left chest mass, I'm going to call this, because we don't want to lose this into the specimen. And you can see all of this tissue has been removed. Let me go in. Complete 100% total capsule removal, all inflamed tissue. Some areas very thin, some areas thick. As you can see, my glove right here underneath, some areas so thin, some areas thick. So I'm very happy how the whole dissection went, and all of this tissue certainly did not look normal. And I'm actually going to cut right through it. Let's see. So We will see what the pathologist says. If you look at the color of this fat, it's not healthy yellow fat, it's inflamed tissue. So I'm going to go ahead and put this here. This is our capsule. Remember, this capsule is so thin, you don't want to just remove this. You want to remove all that inflamed tissue around, because that leaching has occurred into the periphery. Now I'm going to go ahead and take my gloves off so I can go to the other side so I don't cross-contaminate. This is the right side. This is the cancer side. I did the second. I cut out some of this for contouring purposes, as you will see right here. This is the indentation that you see. This is the scar. If I go in and I lay this down, you can see this is the scar tissue that was sutured together. So this has been tagged at 12 o'clock. These specimens will be sent. Now look at this implant right here. As I go in, very happy with how the whole dissection went. It's 11:21. I'm just getting done with my first case, and lo and behold, 2014 implant. It is indeed very much ruptured. So look at this. Look at this. This is supposed to be your safer, what they call the gummy bear. Look at this, the way how it's sticking. There is nothing safe about this implant. And as you can see, look, as I pull this out, you can see a perfect circle. This is the soft, non-textured part where this secondary capsule does not form. And this case, again, like the many cases, another perfect circle because of this clear sign over here. This is the non-textured part. Another clear example that clearly shows implants are not safe. They rupture. God knows how long this has been ruptured for. This lady is 68. At this age, unfortunately, she's had to come in for a surgery. Look how thin this capsule is. You can, if I put this ruler here, you can see how thin the capsule is, where you can actually read 7, 6, 7, 8, and the whole surgery is done such that 100% of the capsule is removed and all of this inflamed tissue. And so I'm going to go ahead and put this here, and let's go ahead and analyze this implant. Look, it's certainly gummy bear, but look, the gummy bear still ruptures, right? And that's the take-home message from this Facebook Live. This is not healthy. You do not want this in your body. It can rupture literally anytime. And if I press over here, you can see, look, the shell. It is gummy, that's true, but it is not safe. And it's ruptured, disintegrated from the sides too. Tell me the person who wants this in their body. The patient who wants this inserted in their body. This is 9-year-old set of implants from 2014. And no wonder this patient came to me. She was hurting, and she got the best surgery without any drains, a flat chest closure. And the other thing I found was a surgical clip, if you will, right here. I removed the foreign body, and then I found what is this right chest mass, suggestive of a lymph node, just like on the left. So I'm going to send this off separately, right chest mass, so that we know. So if you go like this, look at this. We saw this to a lesser extent. The implants are not safe, be it silicone or saline. And they don't belong in the body. They only rupture. Per the manufacturers themselves, you will see they want to get an MRI at year 3, and then every 2 years they're onward looking for what is a silent rupture. And then they mention that the implications behind a ruptured implant are not known. I'll tell you, it is certainly not healthy, so it's unsafe, and that's why they want you to get an MRI. Otherwise, they would not be writing get an MRI. So it's kind of a misinformation that they're giving, trying to be politically correct. Implants, again, are not safe, be it saline or silicone. They don't belong in the body. And when they're removed, you have to always assume they're ruptured till proven otherwise, because you don't want to find out that it is ruptured and then spills into the chest. And no matter how long the drain stays, or no matter how long you wash it out, the silicone poisoning and toxicity will persist. So there you have it. This is Dr. Khan. The Khan procedure we talked about last night. Number 1, twilight, deep sedation, IV sedation. Number 2, no need for unnecessary lift. In this case, doesn't apply. No need for drains. The implants are always returned to the patient. cultures for aerobic, anaerobic, and fungal. Specimens always sent to pathology. Any masses, abnormalities are sent to pathology, and cultures and pictures and high definition videos taken to show complete removal of the whole capsule. And no matter what, how old or how young the patient, how sick the patient, if the patient is sick, that the surgery needs to be done at the hospital, the same surgery that the young 22-year-old will get, so that the patient benefits from the proper explant, which is complete removal of the entire implant capsule and all inflamed tissue. And the surgeon has to go in thinking that the implant is indeed ruptured till proven otherwise. This is Dr. Khan, Executive Plastic Surgery.